It's 1886, and you are the first Black physician in the town of Raleigh, North Carolina. You are dedicated to improving the health and well-being of your people, the African Americans in your town. How would you start? What would you do? I'm Dr. Chad Swanson. I'm an emergency physician, and I'm on a journey to understand and transform our health system. I've spent a large amount of time over the last 8 years with this man, Dr. Lawson Scruggs, and he graduated from medical school in 1886 in Raleigh, North Carolina, the first African American to obtain a medical degree along with the other students in Leonard Medical School. And he lived in a very unique time. So in the late 1800s, scientific medicine with antiseptic surgery and an understanding of bacteria and vaccines was just gaining traction in Raleigh and in towns across the United States. Similarly, hospitals were largely new in towns, and in Raleigh there was just one hospital and another one would be formed in a few years. Public health was around for a few decades, but it was just starting to gain traction. The sanitation movement was gaining traction. Nursing was a new profession. Medical specialties were just starting to emerge. So it's like everything was new and there were unlimited possibilities, but there were also a number of challenges. Of course, race relations were challenging for a Black young physician. There was also rampant poverty. Political situations were difficult. And then just starting a hospital or starting a medical specialty or starting a clinical practice was challenging. So how would you go about this? How would you think about it? How would you start? Of course, he could start a clinical practice. So he could treat patients one-on-one, see patients in their homes or if they came to his clinic, and he did that. And he was very, very successful, both financially and just in the care he gave. But there would be a sense that he might not have been very successful. So at that point in time, in the late 1800s, there really wasn't much that a physician could offer. There weren't antibiotics, for example. There weren't other medications. There wasn't the scientific knowledge base that we have today. And so while he was successful, he must have been frustrated at the same time that his interventions weren't terribly successful. He did recognize that so-called social determinants of health, so poverty, political opportunities, education, and other social determinants of health were incredibly powerful avenues for improving the health of his people. And so he got involved in politics. He was very active in advancing, at that time it was the Republican Party in late 1800s, Raleigh, North Carolina. There was also the opportunity to teach others, and he taught at the medical school there in Raleigh, North Carolina called Leonard Medical School. He recognized that there was a disease, tuberculosis, that was affecting Black people at that time in a significant way. And so he formed a new hospital that could treat tuberculosis people. He recognized that women were underrepresented and not celebrated. Their achievements were not celebrated enough. He recognized the role that women could play in improving the health and well-being of his people. And so he wrote and published a book celebrating the accomplishments of women. It turns out that about 10 years after his graduation from medical school, he teamed up with others at St. Agnes Hospital. There was a nurse named Marie Burgess, and Marie Burgess and other student nurses went out and visited people in their homes, established relationships with the people, got to know them, and educated the people. And through simple interventions, the death rate among Black people in Raleigh plummeted, and that decline in death rate was attributed to Dr. Lawson Scruggs. So that's a little bit about what happened in that time period. And I think there's a lot of lessons that we can learn today. So it can be challenging to decide where we can get our information and trust our information. In Lawson Scruggs' time, it was because there just wasn't much knowledge that was based on rigorous scientific studies. Today, there's almost a sense that there's too much knowledge. So we need to be careful and deliberate in the way that we process scientific information. He also focused on where he could make the biggest impact. Today, we know that only 5 to 20% of our health status that we can change is due to the efforts of doctors like myself in the emergency department and in hospitals and clinics and nurses. And the other 80 to 95% is due to factors like our diet, our sleep, our social interactions, the environment that we live in, our education, social justice, etc. And so as we think about improving our health status, we can focus, as Dr. Lawson Scruggs did, on areas that make the biggest impact. So I hope to connect with you, to learn from you. I appreciate any comments and criticism. Thank you.